Well, the coronavirus outbreak continuing. China is announcing changes to its counting method, while South Korea reports that there are now more than 200 cases there. Alexis Christoforous joining us for today's morning call.
Kiko, that's right. Chinese officials in the province hardest hit by the coronavirus are admitting for the first time today that their methods of confirming and reporting infection numbers have sown confusion and mistrust. China is promising to share data more openly and efficiently, and this comes as China's National Health Commission says another 118 people have died, bringing the total number of deaths in the mainland to 2,236 people. There are now more than 75,000 reported cases of the virus globally. Pharmaceutical companies have been scrambling to come up with a vaccine for the virus. Dr. Margaret Harris, a spokesperson for the World Health Organization, told me this morning that there is some encouraging news on that front, but it will take time.
Now, we have 4 vaccine candidates, which is very good news. That means that testing is already starting. But a vaccine is something you give to healthy people. So you want to make absolutely certain that it's not going to have any untoward side effects. And that sort of testing takes time. I've been a healthy volunteer on testing for the Ebola vaccine. And, they had to test us for 6 months to make sure it wasn't causing any harm. So while the good news is we've got 4 candidate vaccines, you cannot expect to see anything for another year.
Now, drug makers, especially those in India, are bracing for potential disruption from the virus. If they're hit, the impact could be felt around the world. With a majority of some U.S. medical supplies coming from or originating in China, the U.S. Department of Health and Human Services says the coronavirus could have chilling implications for supply chains. India is actually the world's biggest exporter of generic drugs, sending huge volumes of medicines to countries, including here in the United States. Almost 70% of the raw materials India uses in drug manufacturing are imported from China. The drug makers say they have enough supplies on hand to continue production for now, but their operations could be endangered if the virus continues to cause disruption in China. As for a couple of stocks here in the U.S., Mylan, a large generics manufacturer, is monitoring the situation and has put additional protections in place. Meantime, Pfizer says it has not seen any disruption to its supply chain. The majority of its finished products and ingredients are sourced from countries other than China.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.